I'm going to share with you 5 ways in which you can improve your manual therapy skills when you're working with hand and arm injuries. My name is Huang. I'm an occupational therapist and certified hand therapist, and I'm going to say some things that might hurt your feelings, and I'm really sorry, but I hope that you take it for what it's worth, because I am truly here to help you, right? If you're not getting results for your patients or your hands hurt at the end of the day, you might really suck at manual therapy skills, right? Just own it. Listen, I was there when I first started in hand therapy. I didn't know shit from shit, right? I didn't know what I was doing. I was just like, let me copy off someone else, right? Back then, this is how old I am. Back then, you just had to be hopefully in a clinic where there are other therapists. Nowadays, you can go online, you can watch on YouTube, all that stuff. Well, I'm here on YouTube, social media, TikTok, you name it. Everyone's doing something to share what they do, right? To kind of give back. So it's okay to admit that you're not good at something. And I think that the reason why you want to admit that to yourself is because that's the thing that will drive you to do even more, to learn even more, and to get better, right? One, you want to get better because you know, as therapists, we love helping our patients, and we can't help it. You know, you can't help it. But the second, and I think most important thing, is to keep your body safe, to keep your hands from hurting, so that you have longevity in your career. But really, at the end of the day, it's really the only way to help people, right? It's the only way to help people is if you are, you know, if you're not broken, then you have the possibility of helping someone else. If you're broken, there's no way you can help somebody. All right, so I'm going to share with you 5 ways to improve your manual therapy skills. And I'm going to give you some examples too. Now, if you're an occupational therapist assistant, a PT assistant, my 2-day manual therapy workshop can help you to develop your manual therapy skills as it pertains to helping people with hand, wrist, elbow, and shoulder types of problems. I've developed a lot of my techniques. I've used a lot of this with my own patients, so I'm going to include the link below. If it's something you're interested in doing, grab the link, see where I'm going to be, and the dates, right? So I'm going to list out those 5, and then I'm going to give you some examples so that it can help you to improve your manual therapy skills. And these are things that I have noticed when I have gone to teach, giving some of the feedback with my students and things like that. So number 1, use your whole hand. Number 2, use both of them. You would be amazed how some people don't use their whole hand and don't use both hands. Number 2, body mechanics. Use your body, including your legs. You know, hopefully you got some legs and you can use them, but definitely use your legs. And number 4, know your anatomy. Know the bones, know the muscle and tendons, and I want you to think about knowing how it is in an application sense, not in a like, oh, at school, I need to know exactly where it was originating on the ridge of blah, blah, blah. And you know what I mean? Like, you don't need to know it in that detail unless you're studying for the CHT, but that's another point. But really know your anatomy, because it's a way to be able to find on your patient's body and then be able to explain it, right? And then number 5 is learn the various techniques, right? And like I said, I teach a manual therapy course all on hand and upper extremity injuries. So what do I mean, number 1, by using your whole hand? You'd be amazed how when I go around and I teach, and even in my own therapy clinic as I'm training new therapists, people are like, you know, using the tips of their fingers, and they got, you know, pinkies out, right? We are not drinking tea here, okay? You want to think about, how can I use my whole hand? And one of the things I always tell therapists, listen, if you're going to be in hand therapy, the nails need to be short. Sorry, I would love long nails too, but they need to be short, because you want to be able to use your fingers, the tips of your fingers, in a certain way. I use the side of my fingers, I use the tip of my fingers, I'll use, you know, where I put the pressure. Sometimes could be like the back of the knuckle, sometimes it's this part of my thumb. You have to kind of learn about your own hands as well. I'm very hypermobile. I always feel like I'm able to demonstrate, like, this is a boutonniere, and then this is a swan neck. That's how I use to remember which deformity was which based off of, my own fingers. Um, so there's so many ways in which you can use your whole hands, not just your fingers. I use, my wrist as well. So, just think about how you can use your whole hand. And then I'm a big fan of using both hands. So, just like in my splinting courses where I talk about, you have a hand that's stabilized and you have a hand that moves. And then you have to be able to switch it out. So, you have one hand that stabilizes and one hand that moves. And so, in manual therapy, it's the same idea, right? I don't care how small that finger, you might be like on one thing, but there's a lot of ways in which you could, you know, support someone else's hand so that they can feel more comfortable and confident with you. I think the biggest difference in hand therapy versus maybe some of the other types of specialties is in the world of hand therapy, we work with a lot of people post-surgical, right? I mean, I just got earlier this week, a perilunate dislocation that had major surgery, and then the fingers are like stuck like chalk, and there's ways in which you can handle people so that you can help to mobilize them, but most importantly help them feel more comfortable and confident and safe in your hands so that you can get more out of the session that you have, right? So use two hands, people. You have one that stabilizes and one that moves. You have one that stabilizes, one hand that moves, right? So depending on what it is, there's so many different techniques that I teach. So, but just keep that in mind as ways in which to prove your own manual therapy skills. Number 3 is I love using my body, including your legs. So I believe in being in different positions, and then think about how you can use your trunk to mobilize, or even if I'm working with a wrist, I will use my trunk and my whole arm to stabilize and push down to work a very stiff wrist, right? You might do that for an elbow, you might need to do that for a shoulder, but these are all some of the things that I'll talk about in my manual therapy course. And I just want to encourage you to use your body, because when we're sitting across, and I know it's like, that was all I saw. I was going to say that's all I saw growing up, but it's true. Like, as I was coming up in the hand therapy world, I would only see therapists sitting across from their patient, at a table. And one of the things that I realized, for me, I'm a short person. I know I have a big personality, but I'm really, really short. But, I found that if I was working with someone who's short, their arms maybe didn't reach across, or they would put so much nerve tension on it. Or let's face it, everyone has a different body type. Someone with big boobs are gonna, present a certain way that you can't always get to them in a certain way that's comfortable for you and for them. Someone who's really tall, sometimes I stand up and their hands are like up here, so I'm still like, so think about your height and your body in relation to someone's height and their body, and then also with their injury, right? So don't just think about, I have to do a hand therapy right in front of somebody at a table. There's so many positions and different ways in which to do it, but think about how you can use your body, including your legs and your trunk, to give you that strength that you need, so that you're not overusing your thumbs. You cannot, let me see about how I can say this. When you are hurt, you cannot see that it is possible to help someone get to 100% recovery when you yourself can't get to 100% recovery. So you're always going to have that kind of bias. So I encourage you as a therapist to think about how to keep your body safe and pain-free, so you can see that it's possible to help your patients get as pain-free as possible. We all have little biases, and that is one of them. And I know that is a bias that I have seen come across, because I have been a patient due to musculoskeletal types of injuries, right? So, just kind of keep that in mind. especially as you're looking to improve your manual therapy skills. Okay. Number 4, know your freaking anatomy, dude. Like, it's I know it's really daunting to think about how do I understand all of that, right? You cannot learn only in a silo and be like, I have to learn it first. I have to learn it first. No, you learn it, you do it, you learn it, you do it, you learn it, you do it. That's how you get better, faster, and it will make sense. So think about how you can do that, right? Think about how you can do that. Courses are great to help you get your anatomy done in like, in one fell swoop, right? I teach it in a way that is applicable, so you can take it and you start applying it right away. That's the biggest thing that I hope that I do in my courses, because I hated going to a class and the anatomy lesson was so dense that I was like, oh my god, I don't understand any of this, and I didn't know how to apply it. So when I started developing my courses, it was one of the things that I really paid attention to and focus on. And it's something that's important to me too, because as I train and teach my own therapists, I needed to like simplify it so they can get going, right? Only once you get the basics, the foundational stuff, then you can start to apply the details to it. And it is what makes it easier when it comes to learning anatomy. So just, don't think of like, oh my god, I have to know everything all at one time. Think about like, how can I break it down? So if you're trying to do it on your own, just break it down into chunks. Like, I'm a big fan of like chunking things out, because it's just gonna make it easier for you. And if you can make it a little bit easier for you, and you don't feel so overwhelming, you'll actually do the thing that you need to freaking do to get better, right? So keep that in mind. Know your bones, know your muscles, but keep it really simple so you can apply it. Number 5, learn the various techniques. There's so many techniques. So it's not just about joint mobilization. It's not just about lengthening and shortening the tension of the muscles, right? Learning how the nerves glide, learning how to move the scar tissue, learning how the skin and fascia move. Like, those are all various types of techniques. Here's the thing, is that you don't have to think about everything so individually, because, for example, when we move a joint, right, when we're doing joint mobilization, you have to move all of the tissues as well, right? You're stretching out the ligaments, you're going to move the muscles and tendons, but there are ways in which to make it easier. So one of the things that I often teach is, you don't have to stretch everybody and then go ham on it when it's really taut, when it's really stretched out. One of the things I love to do is, hey, can we shorten it, soften it, and then move into some of that manual treatment? Like, wouldn't that kind of be easier for your hands? I wish I knew that shit, at the beginning of my career, but hey, you live and you learn, and hopefully I can pass that message along, and you'll keep that in mind. Think about what you can do in terms of providing manual techniques that are not only effective, but they're not so hard on your hands as well. So those are my 5 ways in which to improve your manual therapy techniques. Get serious about improving your manual therapy techniques, because when you can improve your manual therapy techniques, not only will you get better results for your patients, you're going to save your hands and arms so that you're not hurting later in your career. But the great thing about it is, once you start getting the manual techniques, the critical thinking that is behind manual therapy, which is one of the reasons why I love teaching manual therapy, is the critical thinking that is required to provide manual therapy techniques for your hand to shoulder cases, for non-surgical to post-surgical. That critical thinking is going to help you to pick better exercises, think about how to progress someone, and then over time, as you learn all that, you'll learn all the other things that are related to hand therapy as well, or will just make it easier for you if you know stuff like splinting and wound care and things like that, right? There's just so much in hand therapy, which is one of the reasons why I love hand therapy. There's a lot of technicality to it that is unlike any other joints in the body. So think about that. Keep that in mind. Improve your manual therapy skills. I'm going to include the link below. So if you're interested in learning from me further, you can come and attend any of my live workshops that I do. But I also have my manual therapy on demand, which is all 4, like instead of the 2 days, I break it up into 4 mini courses. You can buy one or buy the other, but you're gonna get the best results when you get all 4, and then you can apply all of it to all your patients, So I hope this video was helpful. Keep those 5 things in mind to improve your manual therapy skills, and I'll see you on the next video.